I found out I had porphyria when I was 15. My sister was desperately ill and I had a genetic test. But it was only a few years later, when I was 27, that I started with any symptoms. And at which point we knew what condition I had, which is often the biggest battle with porphyria. You don't know what it is, so you don't know how to try and look after yourself, which specialist you need to see. Because I knew all of that, it meant that I never really had the severe complications that a lot of people had. Having a big attack is scary, petrifying. The pain is so intense. Opiates, IV opiates, don't control the pain. You don't know what to do with yourself. It's horrendous is the only way I can describe it. I would probably describe it a bit like a toothache, but that it just gets stronger and stronger, and it isn't in one specific place. So I feel it in my legs and in my back. It kind of burns over the whole areas, and it's really unbearable. It's really horrible. You can't sleep as a result of it. You can't concentrate. It's just very difficult to live with. The chronic pain is something I experienced the whole time. So in between attacks, and then it would escalate into acute pain in the throes of a big attack. I think a lot of people struggle to understand that you're in pain the whole time. You look perfectly fine, and it's difficult to describe how horrendous it is. I think sometimes the only time they realise is when you say what kind of painkillers you take and how high doses you take. Like, really, golly. I feel quite emotional now talking about how horrendous it can be, but it makes you quite emotional thinking about how scary, how horrible living with porphyria is. It can make every facet of your life difficult. The condition is so unpredictable. You can't plan to go away very easily. I would like to travel more to places that you can go to where you don't have to try and explain about a condition that is really scary to try and explain. If you go somewhere in English, to try and explain it in English is hard enough. To try go to a different country when you don't speak the language, if you become ill, I just wouldn't do it. It's too terrifying. So the porphyria has had a huge impact on my whole family. There's been times over the years where I haven't been able to look after myself. Bathing can be difficult when you're in throes of an attack. You can't cook, you can't do anything. It's very difficult, so you become reliant on your partner, on your friends, your family. And I've also had to ask for help from my family to help with my daughter when she was really little. I was suffering with attack after attack after attack, and I couldn't manage. It was very difficult. I have a little girl called Abby. She's 2.5. She also has a genetic condition, which has fueled me to do the work and advocacy work that I'm doing to raise awareness about the conditions. I have a lot of hope for the future, and I'm advocating to try and make sure there's a lot of awareness, disease awareness, to make sure that she doesn't suffer in the same way that me and my sister have, because no one should suffer in the way that we have. My name's Sue, and I live with acute intermittent porphyria.